So you should know by now that Joe Biden is struggling with voters under 45. And this is during a time when millennials and Gen Z are being decimated by the pandemic. So let me first give you some information on that specifically. Here you have Derek Thompson with the new Data Progress poll. 52% of Americans under 45 have lost their job, had hours reduced, or have been furloughed. 35% of Americans, this should be under 45, he corrects it later on, under 45. 35% of Americans under 45 now say they don't have health insurance. So this is what is happening right now to the younger generations. And this is during a time when already they were being decimated before this pandemic. So what does Joe Biden have? Well, let me show you Joe Biden's new plan. Joe Biden called for letting more people get Medicare right after Bernie Sanders dropped out of the primary. Wow, that sounds great, right? More people getting Medicare. It sounds like Joe Biden's supporting Medicare for all. Well, not exactly. In a shift left, as they claim this to be, Joe Biden has unveiled a proposal to make people eligible for Medicare when they turn 60. So, just to be clear here, 35% of Americans under 45 now say they don't have health insurance. Joe Biden's solution? Lowering Medicare eligibility to 60. Joe Biden's supporters are all over 45. If you are trying to win the young support, if you want voters under 45, again, I mentioned this in every story I discussed Joe Biden at this point. State after state after state, even in states that Joe Biden won in big numbers, he lost voters under 45 to Bernie Sanders. So while it may appear on the face, wow, look, Joe Biden really dominated these southern states, you look into it, Bernie Sanders still won voters under 45. So if Joe Biden is not going to bring those people out, he's going to lose. You have to appeal. You have to at least try rhetorically, at least pretend like you care. Like, I know a lot of us that are a little more in the know understand that Joe Biden could have the correct rhetoric, but he would be lying, as Joe Biden lies all the time. But it may be enough for some people. Again, if Joe Biden and Democrats actually want to win, it may be enough for some people to vote for him. But if he's not even trying, and his way of trying is lowering Medicare to 60, you're not going to win young voters. I mean, they're going to laugh in your face and they're going to stay home. And also, by the way, even forgetting Joe Biden for a second, that also hurts down ballot races. So you need young people to come out, especially for down ballot races. And for people at home, I don't care how you vote either way. I'm not going to shame you. I'm not sure how I would vote. But what I will tell you is that you should still come out to vote down ballot. So even if you don't want to vote top of the ticket, you need to vote down ballot for Democrats. You do not want social conservatives, at the very least, in control of Congress. But one part of Biden's plan that isn't mentioned here, but it's worth mentioning, it is mentioned here actually a little bit, is that Joe Biden wants to have a public option. So, okay, public option, that sounds, I mean, it's not Medicare for all, but public option sounds pretty great, right? The reality is a public option is not good. And in fact, could kill the potential for a Medicare for all system down the road. So this is a piece I keep going back to in other videos, though I haven't referenced it in a while, but this is a fantastic piece. So this was written by George Baumfolk. He is a retired neurosurgeon, and he discusses why a public option won't work. So he has 3 paragraphs here I want to read because it breaks it down perfectly. So actually starting here, I believe. Yes. The big solvable issue in our healthcare system is the 30% of every healthcare dollar that is squandered on administrative overhead, paperwork, the pre-approvals, denials, and appeals that are an integral part of a myriad for-profit private insurance companies. That's around $1 trillion every year. Only a single-payer system like Medicare for All can cut that $1 trillion in half by eliminating that bureaucratic waste. That half, $500 billion, can be redirected to providing comprehensive health care to all Americans. It's not free. We'll all pay for it in taxes, which for most of us will be less than what we're currently spending on premiums, co-pays, deductibles, and other healthcare expenses. We'll pay less in the end for more healthcare for everyone. Here's where we get to the public option part. A public option cannot save that $500 billion, nor can it reduce healthcare costs. It will only add one more choice of an insurance provider to the current complex mix. Most of us neither know nor care which company provides our insurance. The choice we really care about is choice of doctors and hospitals. Most private insurers restrict that choice to maximize profits. They also restrict our access to healthcare by imposing deductibles and copays, which many of us can't afford. Medicare for All offers free choice of doctors and hospitals with no deductibles and copays. What more choice can anyone want? The other fatal flaw of a public option is that it will likely become the insurer of last resort to the sickest and oldest among us. The insurance playing field will be anything but level. As deficient as they are, for-profit insurers will cleverly market themselves to the young and healthy, leaving those who use more healthcare to the public option. Its costs will balloon, dooming it to fail, to the delight of for-profit companies. So, by offsetting all the oldest and sickest people onto the public option, you drain that system of resources, and essentially the idea of Medicare for All dies because people will assume, well, if a public option doesn't work, then how can Medicare for All work, even though they are two completely different plans in the way that they operate? So in a Medicare for All system, everybody would be on the same plan. Your Congress people, the billionaires, everybody on the same plan. So there is no risk of draining the system as everybody's paying into the same plan. But in a public option, if you have the sickest people on the public option, it simply drains the system of resources. There is no young blood into that system to be able to invigorate the system and actually pay for the sick people. So this is the issue with the public option, and in turn, the issue with Joe Biden. Medicare for All is the only answer. And if he's not even willing to rhetorically say, just pretend that you want Medicare for All, then he has no hope. And look, I don't care if he pretends or not, because ultimately, if he's pretending, then he's not actually getting it done, and then he shouldn't win. But I'm saying if he wants to win, if they cared about winning, they would take on Medicare for All and support it. But it appears they may not actually care about winning. And this is the other problem with the Democratic Party. Their big challenge really was Bernie Sanders. Because either way, the Democratic leadership, the consultants, corporate donors, they have a home in the Democratic Party as long as they have power in the Democratic Party. If they give in to the left and we take power, they lose their power. But if they lose to Donald Trump, they still keep their power in the Democratic Party. So ultimately, they don't really care. Their lives are fine. They still have money. They're good. They can afford their health care. So they have no interest in actually fighting for Medicare for All or for any of these policies that Bernie Sanders fought for, because winning to them, sure, would be nice, but it's not required. It's not required at the expense of them losing power within their own party. So we're going to see the direction Joe Biden goes in, but it appears, at least for now, he doesn't have much to offer.